Hello again. Now, is dexamethasone the answer to COVID-19? The World Health Organization is welcoming the preliminary results on the use of dexamethasone in the UK. Health officials leading a vaccine trial say it could have saved at least 5,000 lives from the start of this pandemic. Researchers say the drug has so far reduced the risk of death for patients who needed oxygen or ventilation. Well, Professor Adrian Purin from the National Institute for Communicable Diseases joining us for our daily chat. Prof, good morning. So let's talk about dexamethasone. What do we know about it? How does it actually work?
So dexamethasone is part of the steroid family of medication, and in fact is widely used in different medical settings, and in fact manages or controls or dampens inflammatory responses. So, for example, asthma is a good example of that. Other skin disorders, also being used in other infections where in fact dampens responses, and that's how it is thought to manifest its abilities to control outcomes.
All right, we are battling with your sound as well. Technology not playing the game with us, Prof. Let's just try one more question and then maybe we can come back to you a little later on. So who will benefit most from the use of dexamethasone?
So from this particular study, it shows that one can reduce the outcomes or deaths in those individuals that are on ventilation, at least by a third, and those on oxygen at least by a fifth. And that's where the main benefit has been seen in this particular trial.
And how should it be administered to those who are in this position?
So depending on your state and in the hospital, you can either, if you are able to take it orally, you can take it in a tablet form, or it can actually be infused, for example, those that are experiencing a more severe form of the disease and unable to take oral medication.
All right, Prof, just for clarity's sake, so there's no confusion out there, dexamethasone is not something that can be used to prevent COVID-19, and it's only for those who have contracted it and are critically ill. They're at that stage where they could die from it.
Yeah, so again, I think your listeners and viewers must be quite aware that, in fact, the indication is really for those who are in high care. In other words, those are in ICU or high care that are requiring oxygen or ventilation. That's where the application is. So if you're well or have mild symptoms, this is not the drug for you. It's really focusing on individuals who need the drug, and those are those patients in high care on oxygen or requiring ventilation.
Now, often when it comes to things like steroids, Prof, we hear of side effects, and many of them are unpleasant as well. What are the side effects, and could this not maybe also be harmful to these patients in some way, even though it does help with treating COVID-19 in those cases?
Yeah, so it can have paradoxical effects in terms of headache, skin disorders, and so forth, and in fact paradoxical infections as well. So that will have to obviously be monitored in order to ensure that there are no poorer outcomes. But based on obviously this particular study, for them to stop the study means that the side effects were not to the extent that they in fact could not continue using this particular drug. But obviously one would have to monitor it and monitor the adverse events.
All right, and just on our side, I mean, you know, the feeling out there is that many lives could have been saved had we started using this drug a little earlier. Just your thoughts on that.
It's always very difficult, you know, as you've highlighted, some drugs do have side effects. So again, you know, you do not want to do harm. And so these particular trials, these randomized control trials, are one way in which we can answer the questions around drugs that are perhaps commonly in use. So hydroxychloroquines, for example, were used for malaria, but we don't know what effect this will have in those clinical settings with COVID infection. So the randomized control trials are if you like, the reference or gold standard, where we can really determine whether these drugs are of particular use. So it's not a matter of just simply not saying we don't want to use this drug. It's really what do we know about this drug in this particular setting, and that's how to answer it.
All right, and I mean, while this is promising, while it is significant and brings some hope for some, there's still a long way to go. So what are the precautions that, the medical fraternity, doctors need to bear in mind when using this drug? And I think it encapsulates everything we've spoken about.
Yeah, so I think it's really, I think the South African government has already said that this drug can now be used, but obviously they will take into account, because again, please, you must remember that this study has not been refereed in terms of publication. So again, we need to really go through the data very carefully just to ensure that these initial statements are correct. Apply the drug, but again, obviously take care in terms of monitoring your patients and the possible side effects that can occur, and determine whether or not it's of use in your particular patient.
And just a very quick one, Prof, before I let you go. We know that when it comes to the elderly, they are more susceptible, they are more in danger of dying from COVID-19. And with age comes them taking a host of other medication for a host of other problems as well. And, you know, I'm just wondering, what are the specific precautions when it comes to the elderly and possibly giving them this drug?
Yes, again, I think one needs to be cautious around providing these types of therapies. Again, as I said, we've not seen all the details. So, was this drug given to a particular set of patients and not others, and what are the reasons for that? So, again, if you're going to apply it in the elderly, is the benefit there or is it not there? So I think those are all the things that need to be weighed up. So I think it's early days. They've made the announcement. They've stopped the trial because they think it is of benefit. And so I think it's for us then to review those types of data, come back to the complexities that you range in terms of drug interactions in the elderly and comorbidities.
All right,
because again, in certain settings, these may not be appropriate.
All right, thanks very much for that. The NICD's Professor Adrian Purin just talking about this dexamethasone and this development when it comes to treating critically ill COVID-19 patients.